Order. All right, we will have John lead us in the pledge this morning.
I pledge allegiance
to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Good morning, everybody. We will go ahead and have roll call.
Gould.
Here.
Dollinger.
Here.
Ferry.
Here.
Millicello. Here. Rice. Here. Summers.
There she is. She just walked in.
So now, here, you have one. We also have her books with us today.
My right hand man is very far away today. Okay, first on our agenda is approval of the minutes from our April 6th meeting. Is there a motion? Moved by Gould, second by Ferry. All in favor?
Aye.
Motion passes. Next you find on your report will be the, on your agenda is reports from our Sunny Hill Nursing Home updates and our Board of Health meeting minutes from March 5th. Anyone want to bring anything up about that? Anything they read in it? No. Next is old business. We don't have any old business that I'm aware of. Does anyone have anything old business they'd like to discuss? We don't have any old business. We're excited about the new business. New business. Our first agenda item is from a presentation from the Will County Health Department. It's our teen pregnancy prevention program, and Cindy is going to give us a little information. Thank you.
Should I go on me to stand, or can I sit?
You can sit, or you can come up there and stand, whatever you like.
Cindy Jackson is our program manager. This is just one of the programs that Cindy manages. And Cindy just recently was invited to Washington, D.C. to talk about this model program. This is one that she entirely developed with her staff. And we're very proud of what they've been able to do in a very short period of time. So,
Thank you for having me. In your packet, you should have a handout that was emailed over, and I just wanted to briefly go over some of the history of why we received this grant at the health department. In 2015, the Illinois Department of Human Services reached out to us, and they were looking at data across the county for high rates of STDs and high rates of teen pregnancy in communities that had a diverse population, specifically looking at the Black and Hispanic populations. Bolingbrook was a community in Will County. It was the only community in Will County that had the data to be eligible for this program. So we worked with the Valley View School District and the Illinois Department of Human Services to write a grant for the Teen Pregnancy Prevention Program. And in February of 2016, we were funded. And so I did bring the data that was used for some of the grant, and there's some additional data in here, so you have a little packet that I brought today, and I was just going to briefly go over that so you can see the teen pregnancy rate isn't out of the world for the general population for Bolingbrook. It's 24.6 for the teen birth rate that's for every 1,000 teens from 15 to 19. And that's only 2 percentage points over Illinois and only about 0.6 for over Will County. So it's not as dramatic, for Will County's teen pregnancy rates are extremely low, actually. They have a rate of about 14 per 1,000 teens getting pregnant. It's, the state was asking us, what are you guys doing? How are the birth rates so low? So the birth rates in Will County are very low, but when you're looking at Bolingbrook specifically, it's higher, much higher than Will County, a tiny bit higher than the state and the United States. But then when you specifically dig down into the populations and you're looking at the white population, the Black and Hispanic population, you'll see in the next chart that for the Hispanic and Black population, the teen pregnancy rates skyrocket. They're at 37.7 per 1,000 teens in the Bolingbrook community. So, and with that coupled with the STD rates, the chlamydia rate and the gonorrhea rate, you'll see, and this is per 100,000, and I also included on the chart the actual number of chlamydia and gonorrhea cases down at the bottom. So in Bolingbrook, the rate of chlamydia was 406.2 compared to in Will County of 340. Also, the gonorrhea rate was 90 per 100,000 compared to 57.6 in Will County. And this is 2015 data. You'll see that for chlamydia in that community, there were 298 cases of chlamydia and 66 of gonorrhea. Also, the other thing that they looked at for grant and providing funding is the way the communities are broke down. So in the very last chart that I provided, there is the data for the Hispanic and the Black and the white populations, and you'll see that for in Bolingbrook, the populations for Hispanic and Black is much higher than in Will County and Illinois. So that was another reason that they picked this community to fund them for the teen pregnancy prevention program. So when we dig down and we start looking at what's going to be required of us for this teen prevention program, they wanted us to implement an evidence-based program in 3 different settings. So the settings we originally selected were Bolingbrook High School, Phoenix Alternative Experience School, and that's an alternative school, and then Humphrey Middle School. So we started to choose and select curriculums that were evidence-based. Both the curriculums we ended up choosing were 13 and 14 module curriculums. So it is quite the commitment not only of Valley View School, but of the health department, because the health educators are, once school starts, they are in the schools as a health teacher most of the time, especially when it comes to the middle and the high school, because the populations are so large in Bolingbrook. So we selected 2 different curriculums, one called Making a Difference, and that's for the middle school, and Making Proud Choices for the high school and alternative school. Both of those curriculums are evidence-based, so they have been studied, they've been proven scientifically effective to reduce the rates of teen pregnancies in community. They're comprehensive curriculums that provide all the skills that teens need to make healthy decisions. So it's not just looking at sex education and teaching them about contraceptives, it's also teaching them about reaching goals and making positive, healthy choices. We have 3 health educators. Right now we'll be hiring a 4th. I actually brought one. This is Shree Woods. She's the health educator that works at the alternative school. And she also is working to develop a resource guide, which I'll talk about in a minute. So along with the evidence-based curriculum that we're teaching in those 3 schools currently, we've developed a teen advisory group, and we're basically using a leadership group of teens to help us make decisions for the community. What is it that the teens need in Bolingbrook to begin to reduce the rates and make healthy choices? Also, they'll be looking at the curriculum, and they'll be watching the videos and providing us feedback on the actual curriculum you're using, because we can make adaptations to the curriculum if it's approved. So with evidence-based curriculum, you have to get every little change that you're going to make to the curriculum approved. Otherwise, it can mess with the fidelity of the program. And we want to make sure that what we're teaching is going to make a difference in that community. Also, we have developed a community advisory group. It is a group of stakeholders in the community that is made up of school members, police liaison officer, we have a PACE bus representation, so we have transportation, we have juvenile justice, we have parents, and we've got a lot of community organizations that are also involved in that community advisory group. And that group is looking at what we can do for the community as a whole, and to support the parents in the community to help them to begin to educate the youth about healthy choices and making choices that's going to protect them and prevent them from becoming teen parents. So in 2016 and 17, in the school year, we had a lot of successes right away. So this grant just started at the health department. We received our funding in February of 2016. So in between February and May, the school we had to pilot the program. So we piloted the programs to make sure that they were going to be a good fit in the schools that we're going to be teaching in, and they were. So with that being said, in August and September, we ended up having trainers coming from ETR, which is the organization that we purchased the curriculum from, that make sure that it's a science, evidence-based curriculum. They keep us up to date on information about it. They brought in trainers, and they trained all of the teen pregnancy prevention programs across the state. And in Will County, we were the only organization of all the 10 funded organizations that actually brought in teachers to train them. We trained 17 Valley View School District teachers. We not only trained the high school health teachers, the middle school teachers in Humphrey, and also the teachers of the alternative school, but we also brought in middle school teachers from the other Bolingbrook schools, and the middle school teachers and high school teachers from Romeoville. And there was, with this being said, all the work we're doing, Valley View School District decided to revise their health policy. They wanted to make sure they were meeting all the Illinois state standards, and so they looked at the health curriculum policy, and they did an overhaul of the policy, and they decided to adopt these two programs for not only all of the Bolingbrook Middle and High School, but they're also adopting it for Romeoville, and we'll be rolling out these programs in Romeoville this next school year. So we've had a great relationship with Valley View School District. They have been wonderful to work with. They've been instrumental in being successful. In 2016, the health educators at the 3 schools that they're currently at, they taught the 14-module curriculum in 40 classrooms. They reached 1,136 teens and taught 505 40-minute modules collectively. Also, we have had other successes besides for doing policy change at the school district with their curriculum. We also worked with our Will County Community Health Center and our community advisory group. They provided letters of support, meeting minutes, and data to help our community health center to apply for a grant to expand family health services or family planning services for the village of Bolingbrook. There's not, as large as Bolingbrook is, there's not a lot of resources for these teens and these parents to get family planning services. They had to come to Joliet, they had to go to Planned Parenthood in Aurora, they had 26 miles either way to get services. So with this data and with the collaboration with our community health center, we were able to bring family planning services to Bolingbrook, and they will be rolling those services out at the end of June for the community. So that was another huge success for helping to bring down these rates, get teens tested, and also give them the resources, contraceptives that they need to protect themselves from becoming teen parents. Also, one of the things the teens kept saying is, we need condoms. They're expensive. It's one way that we can protect ourselves. You know, we're trying to help them make the decisions that they need and give them the skills that they need. And one of the skills that we teach them is how to use contraceptives. And so they asked for condoms, and we have now rolled out a program at our North Branch office and have condoms available, and we promote those in the schools, and the teens are going to Bolingbrook and they're picking up bags of condoms so they can be protected. They can't afford condoms. They're either too embarrassed to go buy them. We have made them available at the front door so they can go in and just grab them. They don't even have to be embarrassed to ask somebody what they're there for. They know where to go. They know what door to go into at the health department. They can just grab those so they can have those available for themselves and their friends. So since 2016 was so successful, in 2017 with rolling this out, we have been funded an additional $65,000 from the Illinois Department of Human Services. They would like us to hire another health educator so we can expand to the other 2 Bolingbrook middle schools. So in 2017 and 2018, we will be in every middle school in Bolingbrook. There are 3 middle schools and then the high school and the alternative school that we will be in with our health educators. And we'll be also working with the Romeoville schools to try to train and get their teachers up to speed so they're ready to implement in the 2017-2018 school year. And in 2017 and 2018, our health educators will then have taught 60 classes, this 13 or 14 module curriculum, reaching close to 1,800 teens. And they will also be expanding this into, they've seen the successes at the high school level. They have a STEP campus at Bolingbrook. And this is a campus for 18 to 21-year-olds, training them and getting them ready for the workforce. And these students have learning disabilities, and they have reached out to us and asked us for resources for them as well. So we provided them curriculum, and they're going to be adapting the curriculum for that older population because they know it's really important because that older population are really starting to dabble and they need the skills that the other teens have that they didn't receive when they went through high school. So all in all, it's been very successful, and this grant will run through June of 2020, and we're hoping that once the grant is up that there will be some sustainability funding, but if not, we are working on a sustainability plan with the school. That's why we're training all the teachers. That's why we have provided all the teachers with curriculum. Once this program, once you've trained people, once you've purchased all of the curriculum that you need, the program is fully sustainable if the school has a policy to support it, which it does. There's no cost. They provide you the worksheets that you can make copies of. You don't have to purchase workbooks. You have all the videos, everything you need to be your tool to teach this and to sustain it for years to come. Do you have any questions? Yes?
I'm a resident of Bolingbrook, and thank you for your work. I did have two questions, one which may be impossible to answer. The first one, I was just wondering, when this is taught, the modules, I know I have a niece at Bolingbrook High School, and she's actually commented a little bit about some of the programs there. Is it always during health class? It doesn't vary what class it's not.
That's a good question.
What curriculum it's replacing?
This is a part of health class. It is already built into the health sessions, and in the high school and the middle school, we're implementing it during the health class. So it's not taking away from the health curriculum. They're just using this evidence base instead of the things that they were using in the past for sexual health education.
Okay, so is there ever a time in a middle school or high school student that they are not necessarily in health class, that they would be missing this?
Yeah, so they, in the high school, I believe, and Kate, or Sheree, tell me if I'm wrong, they only do health once. And they typically do it in their 9th grade class. That's why we're making sure we are in every single health class in Bolingbrook, so every student gets it when they first come through. We are seeing, though, that some students are having to retake health, and so they're getting it all the way through 12th grade as well. So it's always in health. We're making sure, and in the middle school, we're reaching the 8th grade students, so we're getting all 8th and 9th graders every year for 5 years that we'll be doing this grant, and then they'll continue to do this.
Okay. And then, are there any theories about why the birth rate, for teenagers is higher in Bolingbrook than throughout the rest of Will County?
It could be because of the demographic makeup, but we don't have anything that pinpoints exactly why the birth rates are what they are in Bolingbrook. The birth rate itself, overall, isn't that high, but then when you dig down and you look at the population, it is higher in our Hispanic and Black populations. You're welcome. Any other questions?
I just want to thank you for coming today and giving this information. It's very informative, and it'd be great to come back maybe next year and see, has the program worked? Have we had any positive outcomes? And I'm not saying we're going to drop significantly, of course, in the number of births, but and the sexually transmitted diseases. But it'd be kind of nice to know how it's working.
I would love to.
Go from there.
We are collecting data every single year, so every year we're collecting the data, so we'll be able to see a trend for the teen birth rates and the sexually transmitted infections in Bolingbrook.
Okay. All right, yeah, that would be really good to see. I mean, and hopefully you have a good impact, because it's something that kids aren't always thinking about. You're young and you think, it's never going to happen to me, because I'm invincible, I'm a young person. And then it happens, and then you don't know what to do, and that's, a problem. I guess I do have a question, is if you do have students that come forward during this class to their teachers or something and they're pregnant, do you have a plan with that, or what do you do with that?
We actually have been trained to make sure the health educators to make sure that they have a trauma-informed approach, to make sure that they're not they will not be pulled from the class. My health educators are trained to teach the curriculum so it's not adversely affecting teen parents, children that have already had sex. They are making sure that they're inclusive of all students and making sure that they're using terminology and language that will not offend anyone that has had any of these situations occur to them.
And so then, with what you're teaching, if the student comes forward and says, hey, I think I have this, then the teacher is sending them, where do we send a kid then?
So, and that's one thing I didn't really talk about. It was a community resource guide. So in Bolingbrook, there's not a ton of resources. So we have been compiling a resource guide that'll be available in the end of June that is specific to Bolingbrook. It has every sexual health resource that the students might need. There's behavioral health services, there's counseling, there's adoption services, there's every service that they might need. So not only can the teachers, the schools, and the community stakeholders refer these teens to these resources, but we're going to have a teen-friendly guide so the teens can themselves access these resources, find out how to use them and where they can go, and also educating them on the laws and the rights that they have as a teen to do these things without parents.
Right, and that's good because, I mean, down in my area, we had a college student who was pregnant, and then she ended up having a very unfortunate event happen where the baby was born and then the baby died, and I'm not going to go into all the details, but if the kids understand that, you know, somebody's there to help them if they find themselves in that situation. Of course, we don't want them to get pregnant to start with, which is why you give them the condoms, which is good because they would be embarrassed to go to the store and buy them, you know, and so it's kind of good to do that because what do? We don't want that to happen. We want that situation because if you can't parent, there's always adoption. And, you know, I'm glad that you guys have all that information for them.
Yeah, we want to make sure that they know every resource that is available to them. And we'll be, once the resource guide is completed, we're going to be working with the school district to start to schedule presentations so we can meet with all of their social workers, all of their guidance counselors, and also their teachers and their health teachers. So they are all aware of these resources and they know how to refer to the resources.
And I have one other thing. I know when my kids were in 5th grade and they taught DARE and they had health class, and they started talking about sex education. What I found was hard was that I never knew what was being taught to my students, and my children, you know?
Mm-hmm.
So it's like, do you have any kind of a presentation that you could do like at the beginning of the school year? Parents could come and say, and this is a very brief presentation of what we are teaching your children, and then if you find yourself in a situation when help, you have that resource guide, things like that.
We actually have, and it started last school year, my staff go to the curriculum nights at each of the school. They're there, like the teachers are there presenting the curriculum, talking to the parents about their curriculum. We'll also in the next school year be bringing Robert Crown Center out to teach parents about sex in the digital age, doing a presentation at each of the schools. At that time we'll also be presenting the program, our program, to the parents as well. We're also working on messaging, media messaging. We're working with the high school to develop a health resource page on their website so people can go there to not only look at the curriculum but also look at the resources and find more information. There's some parent education newsletters that will be going on there that we've taken from the CDC that we'll be using as well.
No, that's really great. I mean, that's very informative and probably a program that'd be great at every school, but it's good that we have this here and this pilot, so that's absolutely wonderful. Thank you, ladies, and thanks, Sue, for having the girls come out today.
Sure.
Anyone
If
have
I
any?
could just raise a comment.
Sure, go ahead.
You know, this is to the core of what our agency is supposed to do. This is public health. This is trying to prevent disease. This is trying to prevent situations that are, you know, that negatively impact our society down the road. If we can educate the teens, if we can educate the middle schools, the parents, anyone and everyone about this topic, if we can do a good job doing that, it pays down the road. We have less teens, less people with STIs. We have, and as you know, that can be expensive for treatment from a public standpoint. And we also have less teen moms who are out there trying to raise children without resources, and again, burden on the community. So this is to the core of what we do. And after hearing Cindy's presentation, I think you see why she was asked to go to Washington. I don't think they missed a beat. I don't think they missed a thing. They looked at this from so many different angles and got so many different people involved and just did a fantastic job. The sustainability is also important. I've spoke with many of you over the last year or so about our grants and trying to make sure that they're sustainable. It's not one of those things where, oh, we get a grant, we ramp up, we hire a few people, we go out and do it, oh, money's gone, we pull out, nothing happens. This is the approach that we want to take, that we're trying to take with our grants. Go in, do what we need to do, train the trainer, do whatever we need to make it a sustainable program so that when the funding is gone and we do have to pull out and leave, we've left something. We've left something positive. We've left something educational. We've left something that the community can use. So this is it. This is what we do.
That's perfect. Go ahead, Beth.
Yeah.
I, as a Bolingbrook resident, realize there aren't a lot of community resources in Bolingbrook as opposed to some other communities. I love that you're working on that guide. How could I get a hold of that guide so that I'm a little more aware?
When it is completed, I'll make sure that each of you have a copy of the resource guide that we're developing. It also will be available on our website. It will be on the school district's website. We'll have paper copies of it, so it's going to be a nice little booklet that's really colorful and teen friendly. We also want to make it available to all the community organizations and the stakeholders in the community so that they know where to refer their teens.
That's great. And I love we have Cherie, right?
Yes.
Because she's got that nice young face. It's easy for the kids to, well, it's easier to go to somebody who's more your age group than coming to like somebody who looks like a mom, because it's harder to say, oh my gosh, I was having sex. And you don't want to say that when you're kidding, though you are, and you shouldn't be. So it's great to have a young face, and they're more comfortable going to that talk with her.
Just a question. So, do parents have access to the curriculum? I know I just went online and tried to bring it up, and you have, they give you an outline of the agenda, like all the chapters and all that kind of stuff. Do they have access to the more details of it, or do they have to purchase it themselves? Because I see it's pretty expensive.
You have to purchase it. You can request a sample of a module online. But we can provide parents, we can't provide a copy because we can't make a copy of the actual curriculum, but if there is any parents that are questioning and they would like to sit down and meet with us, we'd be happy to go through step by step with the curriculum.
Okay, so you do make that available
Yes.
for parents? Okay, yes.
Okay, thank you very much, Cindy. I appreciate it.
Thank you.
Okay, next on our agenda is a presentation from our emergency management Harold Damron. They recently went to FEMA training for terrorist attacks, and Harold is give us what happened at the training session. A little bit, not obviously everything.
Good morning, everybody. Thanks for giving me a little bit of time on your agenda to, I feel like I'm giving a presentation on what I did on my summer vacation. What we did last week. Last week we had 55 individuals from Will County attend a training program at FEMA's National Emergency Training Center, which is located about an hour north of Washington. The training center is home to two different training institutes. There's the Emergency Management Institute. There's also the National Fire Academy. A lot of our senior fire officials from Will County have been out there over the years attending NFA classes, and the Emergency Management Institute, or EMI, is the training program that sponsored the course we were at last week. And the course we were at is what they call Integrated Emergency Management Course, or IEMC, a lot of acronyms. IEMCs are training courses that are a little bit unique in the FEMA training realm. These courses focus on one particular threat, and they're also jurisdiction specific. So instead of a course that's open to anybody to attend, these are closed courses. And Will County was fortunate to be selected for one of these courses. This process began a little over a year ago when FEMA put out their solicitation for jurisdictions to request to be selected for an IEMC course. I have here from my office Allison Anderson. Allison coordinated the whole effort. She walked into my office back in, I think it was April of last year. We both got the same solicitation notice, and she started talking about it, and we said, hey, let's go ahead and make an attempt at being selected. And about 3 months later, we found out that we were for this particular course. 6 jurisdictions in the United States were selected for the 2017 program. So this IEMC, the hazard that it focuses on is what they refer to as complex coordinated attack. Things such as Paris, San Bernardino, NIU, Virginia Tech, those types of situations. We don't like to think about those situations. We always think that it's the other place that it's going to happen. But to everyone else, we are the other place. So like a lot of other hazards we have to be concerned with, this is a very important one. And so we set about selecting different individuals to help represent the Will County community to go. As I said, we had 55 individuals that attended. That included representatives from 18 different communities in Will County. We had representatives from 7 different county offices. Nick Palmer was there on behalf of the county executive's office. Under Sheriff Contro attended on behalf of the sheriff's office. We had Elizabeth Bellata and Katie Weber from the health department. We had the coroner's office. Dr. Walsh from the school's office was there. I'm probably forgetting some others, but about half of our makeup was law enforcement and fire officials. The other half represented various disciplines such as public health, hospital. We had a couple individuals representing private industry, private facilities. We had school's office. We had a public works representative. We also had some of our what I would refer to as state partners. We had our state emergency management regional coordinator. We had someone from IDOT's emergency preparedness. We had someone from the Illinois National Guard. We had American Red Cross. So we had a good makeup to help represent Will County. So we were there last week for 4 days, and the program essentially allowed us to do 2 things. First of all, we had a chance to learn from some very good authorities on the subject. For example, we had the police chief from San Bernardino was there. He gave us a rundown of their incident, how they dealt with it. We had the former deputy fire chief from Arlington, Virginia. Arlington is home to the Pentagon. He was the operations chief for the fire department at that time, in charge of the fire response to the Pentagon attack. We had a gentleman from George Washington University who literally was one of the authors of what's referred to as emergency casualty care, how to deal with shooting victims in a mass shooting environment. He wrote the curriculum that people are being taught to today. We had some individuals from the National Suspicious Activity Reporting Program, about their program. We had an individual from the Department of Homeland Security going through improvised explosive device familiarity or IED familiarity. So we had a lot of good subject matter experts that comprised about half of the agenda. The other half of the week we spent in in breakout sessions. We had two different groups that we were divided into, and through some facilitators, we walked through a fictitious scenario, purely to drive discussion and to let us break down into some very small parts how do we respond to such an event. And that gave us an opportunity to look at things we do today, what are some things we're doing right, what are some things we're doing that we could do better, where are some gaps in our preparedness, what can we improve upon. So a lot of outcomes. I think we captured somewhere in the neighborhood of about 30 different outcomes were captured for us. FEMA is going to be providing us an actual follow-up report in a few weeks. They've captured all that information for us. So that gives us a playbook to come back. And the good thing about having such a large audience attend is, you know, if 5 of us went, then 5 of us will come back with all this information, and now we have to try and explain this to a much larger audience and convince them of these things we should move forward with. But you know, we had close to half of our fire chiefs there. We had close to half of our police chiefs there. So a lot of them got exposed to some of these ideas, and it'll make it that much easier for us to start to look at some of these things, try to implement them. A couple examples without getting into too much detail. We talked about before an event occurs, how do we share information, how do we share intelligence. We have some good ways of doing that, particularly within certain disciplines. You know, law enforcement's generally good about sharing information. fire service, but sharing information across different disciplines is something that we talked about. We also talked a lot about the integration of response when something like this occurs. The closeness with which the law enforcement and the fire teams have to work when they're not just dealing with the bad guys, but also trying to render quick care to the victims in such an environment. So that's just a couple examples of a number of things that we can look at and learn from. Some other things that we touched on that week included social media and how we, number one, can use it as a information source, and also how can we leverage it better to put information out to the public during an emergency. So we had a good subject matter expert on social media. Our intention going forward is to take all these different lessons learned and again try to look at these, prioritize the ones that are probably the most important, look at the ones that might be the most achievable, some low-hanging fruit, so to speak. Since we did have a large contingent that went, hopefully we can break up some of these ideas into some smaller working groups and try to push these forward into some actual changes. So again, just to use an example, that integration with police or fire, it's good if we have individual communities working on that, but when something happens and we have 20 fire departments and 20 police departments descending in one location, we can't have 20 different versions of how to interact. We need to try to have some kind of standardized way for them to interact so that when they all come together, it's the same way. So some of those types of things, how can we standardize some of that kind of response? It's just one example. Just as an aside, the training center, in addition to being home to those two academies I referred to, is also home to the National Fallen Firefighters Memorial. And since we had such a large Will County contingent there, probably never have so many Will County people there at the same time again, we thought it'd be a great time to recognize Will County's fallen firefighters while we were there. So we took some time after class one afternoon and presented a wreath at the Firefighter Memorial on behalf of the 19 firefighters in Will County that died in the line of duty over the years. So that was just a good opportunity for us to recognize them while we were out there. So it was, again, a unique opportunity that we had. It was also wonderful that, for the most part, with some exceptions, it was all funded by FEMA. The travel and the lodging and the course itself was all at the federal dime. So that made it just that much more easier for us to go there. So I don't know if either Nick or Undersheriff, if you have any comments about your experience there.
Good morning. I'd first like to just thank Harold and Allison. It was very well organized and made it a very enjoyable trip. Getting that many people across the country and organized was no small feat, so thank you to both of you. Just quick takeaways I took away from the training was, people sometimes say, well, that would never happen here. Well, after hearing the presentations by the police chief from San Bernardino and some of the other experts, it definitely could happen here. We have a lot of targets, and when we went through the scenario, you could see how it could happen here. I thought it was very interesting since Columbine, the change, and I was telling Chairwoman Gala about this, the change in tactics as far as medical response. It used to be stage and wait until the bad guys were subdued, and by doing that, people died because they bled out, and so the change in tactics has been more to go in sooner and try to rescue the people you can rescue. So that was very interesting. And here, some of our communities are already doing that, but others are moving towards that. So that was, I think, a positive thing. The other thing, I know board members don't always see this unless you visited the EMA, but we do regular drills because we have the nuclear power plant here and then the other one in a neighboring county. So we have a basis where we do a lot of these drills. For nuclear, and that involves the communities that are directly impacted, but this exercise, I think, in Maryland was a good seed planting for doing this with other communities that have, like, the racetrack or the county fair or other major events which could be targets for terrorist activity. So that kind of leads to my last point, is just that I think at the end of the training, it was positive to hear, people are gone from their work for 4 days or thinking about all the work they've got to do. but yet overwhelmingly, the group seemed pretty positive about carrying this forward and regrouping. We're asking when is Harold and Allison going to organize a follow-up meeting so we can put some of these ideas into action. So I thought that was real positive, that our police and our fire chiefs and everyone else was excited about taking what we learned and trying to build on it and train. And I guess one last point I think is important, which is why I decided to go, was sometimes you interact with these people only when there's a disaster, because sometimes county government doesn't, at least the elected officials and myself, we don't interact with the fire and the police guys every day. So this was an opportunity to get to know some of those folks and make those connections so that, God forbid, if we do have a disaster, you've already established some relationship and you have some game played. And I think that's what's going to come out of this, is we're going to have reinforced ideas about how both all the police and fire and first responders, but also as elected officials, what our role is, and really being clear on what that role is in the case of a disaster. So, but overall, very positive, and hopefully we can share some of that future work with the board as it becomes available. So.
Yeah, that'd be great. Thanks for that summary, coming from somebody who's not in your realm. It's good to hear somebody who's just a regular layperson, just how it impacted him with the learners. So that's great.
If I may just to add on to a couple things Nick mentioned, we do a lot of exercises here. Probably the highest profile one tends to be the nuclear plants, because we need to do that every year for federal requirements. But a lot of exercises occur around here at one level or another. In a couple of weeks, we have an exercise we're doing with several communities in the eastern part of the county, and the scenario there is long-term power outage. What do we do if not 2 hours, but what if the power's out for 2 weeks? That type of scenario. So we exercise for a lot of the different hazards, a lot of the potential threats that we have, and there are a lot of commonalities. Some of the things that we would do for a nuclear plant accident are the same for a flood or a tornado or a terrorist attack. But this particular threat certainly has some unique characteristics to it, as do just about every hazard. It has some unique characteristics that we have to try to tailor plans for, and this gives us an opportunity to do that. And also, Nick mentioned that sometimes as an elected official, there's not the same interaction as maybe the police and fire folks have every day. We were fortunate to have a mayor attend to help represent elected officials from the local municipal government level. Mayor Schumacher from Shanahan joined us, so we were glad to have her take time as well. And I also do want to just again thank Allison. She was the one that again coordinated this thing from last summer up to getting 55 grown adults all the way across the country. I think they all came back. We might have lost one or two, but we told them that was their responsibility to get back. We got them there. But it was great. We got a great, unique opportunity. Hopefully we'll get a lot of gain from the effort.
That's fabulous. Anyone else have anything they'd like to say or ask? All right, great. Thank you so much, Allison. Thank you for coordinating, and it's good to hear that you have training that in case something happens, because like Nick said, we have a lot of targets here, and it can always be. We always think it's somewhere else, but it can always be right here. So practicing for the unbelievable situation is something to do. So great. Thank you very much.
Thank you.
So I think we've all heard so many things today. It's like amazing, isn't it? Okay, next we'll move on to other new business. I don't have any other new business. Anyone else? Gloria?
I just want to say thank you to Karen and the people at Sunny Hill. We had a tour yesterday and lunch at the facility, and it was just fantastic. And it makes us proud to see what you have going on there. So thank you
so much, and thank you. Thank you. Thank you for bringing that up. I wanted to mention that, and I want to thank everyone who attended. We had quite a few people from the county board, and we had a lot of people from the staff area, which was really nice. And we had a reporter along with us, so that there'll be a nice article in the Farmers Weekly Review to put the information out there and share the little bit of Will County that we have for our senior residents. And I know everybody was happy to be there, and they got to see how nice and relaxed the place is, and how well organized and how clean it is compared to other facilities that we've all been to. So thanks, Karen, for having us. Okay, we'll move on to public comment. Is there any comment from the public? Any comment? There's no public today here. I do not have any report or announcements. Next is executive session, which we do not have. So I'd like to have a motion to adjourn. Motion by Gloria, second by Debbie, all in favor?
Aye.
Aye. Meeting adjourned, thank you.